thank you for having me. And apologies I couldn't make it in person. I have actually been to the Fields Institute a couple of times, and it's funny. Nick and I were together at the Fields Institute last in January, February of 2020, and obviously, as most of you will know, that was a relatively eventful time because we arrived there to the Fields Institute, and there was a public health event on just starting to trickle its way through the globe at that time, and we sort of had an impromptu meeting with the scientists in the room that you're sitting in right now to talk about this new disease and if there was any modeling that could be done to help inform the government at the time. And so little did we know that we would be 3 years away from seeing light at the end of the tunnel. But here we are, and I think it would have been a nice opportunity if Nick and I could both have been there, but unfortunately we can't. So hopefully this will suffice. So just to give you a bit of a lay of the land, and it's going to be a challenge to follow the previous speaker, I have to admit. Odeya sounds like a very attractive place to work. We have no ping pong, we have no go-kart racing, and we have really very few of those sorts of fun activities when you're working with the government of Canada. But I think you get a lot of satisfaction in other ways when you're working for the Public Health Agency of Canada, in terms of the personal satisfaction if your goal is to try to contribute towards public health outcomes. And so our locations are for our specific division is in Saint-Hyacinthe, Quebec, and in Guelph, Ontario. Most people would think we're very Ottawa-centric as the Government of Canada, but we have absolutely, well, not absolutely, but very little presence in Ottawa. Our other main sort of footprint is also in Toronto on Queen Street. We have a few office spaces there, but just one or two scientists there. The Public Health Sciences Division is actually part of the National Microbiology Lab, which, as many of you may know, is located in Winnipeg. And so we are the only non-lab benchtop kind of scientists working at NML. Our work, as you would guess, since I'm here at the Fields Institute talking to all of you, is much more desk science in terms of computer-driven science. So what is the division? The division is essentially composed of two primary sections. There's the risk integration, synthesis, and knowledge section, which I lead, located in Guelph. Our focus there is primarily on risk and mathematical modeling, looking at risk assessment, decision analysis approaches, and also knowledge synthesis. So integrating science and looking at the evidence, the value of the evidence, the strength of the evidence in order to form public health decision making. And the second section is the PED section, which is a population environmental determinants. That's located in Saint-Hyacinthe, and they too have got a lot of risk modeling and risk assessment. But the other distinction there is primarily a group working on geomatics and earth observation work, and also a lot of advanced epi studies. So our priority areas pre-COVID, and I'll get into why this expansion happened, was primarily looking at vector-borne, foodborne environmental diseases. We were looking at antimicrobial resistance, zoonoses, and climate change-driven sort of factors. The priority areas changed or have been added to post-COVID to include all respiratory diseases. Our main focus pre-pandemic was obviously all of these other things except respiratory diseases. What we found, though, as I mentioned, arriving here in February of 2020, was that there was very little expertise within the agency left after government cutbacks to do infectious disease modeling for respiratory pathways. And so our group was the sort of quorum of expertise within the agency in modeling of any sort. And from that foundation, we started to build up capacity, essentially building the plane as we were flying it. And I think having a lot of academic partnerships, drawing on graduate students over those 3 years, drawing on academics, we've built up a significant risk modeling and infectious disease and mathematical modeling expertise. So this essentially gives you a little bit of our sort of structure. And we're not what you might typically consider when you think about a government department. We have a lot of academic collaborations and partnerships. Our scientists and modelers in the division, many have adjunct faculty positions at universities. They serve on graduate committees for students. We utilize a lot of co-op master's students, PhD students in terms of doing work study sort of assignments with us. And so we don't really operate as you stereotypically might think a government organization might work. So our main sort of areas of expertise is looking at, where do infectious diseases occur, who's at risk, when they occur, and how can public health best respond. Those are sort of the four kind of things that we do, and we apply all of those tools that I described to bring light to that. As I mentioned, there's the risk modeling, so looking at quantitative and qualitative risk assessments, predictions to look at where they might happen. We're using geomatics as well to look at, what the environment and population data looks like in order to sort of look at risk factors. That comes to play a lot in vector-borne diseases, for instance. And also in terms of just not your traditional sort of mathematical modeling, but bringing quantitative skills into the decision-making arena, with things like multi-criteria decision analysis, tools to help decision-making in terms of prioritization of choices, etc. So just a little bit of overview of the kind of stuff that I'm talking about. As you can see, I mean, a lot of stuff that we've been concerned about has been climate change, and so we've got a lot of models and a lot of projects underway looking at how climate impacts both vector biology as well as agricultural dynamics, reservoir hosts, etc., and how that might change over time. Modeling of Lyme disease vector spread with climate change. So as temperatures and climatic conditions change, how does Lyme disease expansion occur over time? And so these are time scales of essentially tens and 20s of years into the future, using climate models predicting how climate might change in Canada, and then integrating that with the spread of vectors to come up with risk maps. And these are key in terms of not only allowing for prediction, but to inform surveillance strategies as well. Similar with chikungunya and Zika virus transmission in Canada. So looking at the suitability of the climate in Canada as climate changes for the mosquito vectors to potentially establish. And so, that's a couple of pieces of the risk puzzle is the introduction of the disease, the introduction of the vector for the disease, and then the potential establishment of the disease vector in Canada. And the key there is survival over winter freeze cycles as well. And so all of those factors come into play, and we attempt to look at that. Looking at food, so vector-borne, but also the food safety side of it, and applying models for them is an area that we've focused on. Mosquito spread and the potential risks associated with that. And then during COVID, as I mentioned, we took the skill sets that we previously were applying to other areas and had to adapt and expand into looking at pandemic sort of modeling. And so, there was the traditional kind of initial modeling to look at uh, the effect of various controls and how that might have an impact on the attack rates over time. Um, we expanded into looking at importation risk as the pandemic spread and as new variants arose, looking at which locations around the world might be contributing or most likely to be contributing what variants into Canada, as well as what airports within Canada those variants and maybe arriving at. Again, this was primarily for uh, not prediction for prediction's sake, but also for surveillance purposes, so we could capitalize on assigning resources appropriately. During the pandemic, using mathematical tools for forecasting to look at, both short-term forecasts as well as longer-term forecasts with respect to where the pandemic would be going over the coming periods. We're waves at a crest, where we at the start of a crest. So using hospitalization data, using testing data, using clinical data to to apply to models. And a lot of this work was also done together with academic partners, developing models, graduate students coming to work with us with the knowledge they had learned from their graduate studies and then applying them. Um, Also looking at the effectiveness of various control methods. So, combinations of interventions, including, test and trace strategies, vaccine applications and vaccine logistics, to look at what kind of an impact that might have on the outcomes. Um, and so, I think what we learned during uh, those 3 years was that there was a significant lack of expertise within the government related to mathematical modeling. And what we demonstrated quite clearly during those 3 years was that mathematical modeling can be a key piece in informing public health decision making. And after, I would say decades of in some ways trying to make the case for modeling, it took a pandemic and real world demonstration of how modeling can help inform decision making for decision makers at various levels of government to realize that there is a true value in modeling. And so there's been a rapid expansion in terms of recruitment of um, scientists and mathematicians that can work in this area. Um, and we have expanded significantly over the past 3 years from essentially 4 modelers to, well, there was 4 modelers in Guelph, and we now have um, nowhere near the nowhere near the 100 new employees, but we're looking at least 10 uh, 10 people in Guelph alone, and then 16 people in Guelph, counting knowledge synthesis and modeling, and then another 20 people in St. High, working on modeling and geomatics. So a reasonably big expansion, but the biggest piece of this has been practical and clear demonstration of the value of modeling to help inform decision making. Since then, we've also expanded to utilizing, for instance, wastewater surveillance data to forecast the trajectory of the pandemic. As clinical testing has declined, wastewater has offered us a lens into what's going on in terms of infectious disease in the community. And that doesn't only apply for COVID, it's being explored for other infectious diseases as well. From the geomatics side, obviously there's looking at the determinants of health from One Health. So looking at spatial information and attempting to extract information on what are the determinants of health, again, for public health decision making. Clear example here would be, using remote sensing data to look at the environment, looking at vegetation indexes, for instance, surface humidity, surface temperatures, in order to predict how those characteristics might help sort of look at the probability of Lyme disease vectors um, surviving and thriving in those environments, and then using that to generate risk maps to help inform surveillance, etc. Um, the geomatics group was also key in terms of developing just dashboards and so on uh, for the government during the pandemic. Finally, on the knowledge synthesis side, the key distinction or a key piece that separates us from many other modeling organizations is that we have a dedicated team of people working in knowledge synthesis. So looking at emerging scientific evidence, applying rigorous tools to extract the evidence, evaluating the strength of the studies to inform decision making. Those skill sets have been applied to look at um, what the evidence says about either interventions, about an emerging infectious disease, about diagnosis methods, so that whatever advice is given is based on the best scientific evidence. Um, and again, we've been applying those tools to the entire spectrum of topic areas that I mentioned earlier, from vector-borne diseases to foodborne disease. Over the pandemic, we did a lot of work on how, as many of you know, there was a lot of evidence being generated in terms of hundreds and thousands of papers uh, being produced on the COVID pandemic, and the challenge there was to try to come up with, um, extract the valuable information from the less valuable information in order to help inform. And so that's been a key piece of the kind of work that we've done. And then obviously, as I mentioned, just taking all of these other pieces of information, either from modeling, from knowledge synthesis, applying MCDA tools for things like prioritization. So an example of looking at, which vector-borne diseases are likely to be the most critical for us to be concerned about as climate change occurs, and so developing a prioritization there to look at, which ones would we need to focus on, either from a surveillance, from a research perspective, or from a knowledge gathering perspective. And as I mentioned, obviously during the COVID-19 and the MPOX outbreak, with the massive flow of information that was being generated, there was a real hunger for, outputs that could synthesize all that information into key public health uh, inputs. So with that, I'd be happy to take questions